afternoon, good morning, good evening, depending on what time zone you're joining from. So my name is Sarfraz Hasni, and I am a physician scientist, a rheumatologist based in Bethesda, Maryland, at the National Institutes of Health. And I'm the moderator for this session. And we have these sessions through the platform of APPNA, which is the Association of Pakistani Physicians of North America. And this is the MERIT subcommittee, which is Medical Education, Research, and Technology Transfer. We held these seminars for the last few years and been doing it every other Saturday, so bi-weekly, and at the same time at the Zoom channel. So it's my honor and privilege to be the moderator and to welcome all of you for joining us. And the panelist discussion is going to be conducted by Dr. Uzair, who's joined, and Dr. Akhtar, who have joined as panelists, and others may also join. Today, we have...
Dr. Sarfraz, you are muted.
Can you hear me now?
Muted. Yes, perfect.
Okay. Did you hear earlier part or just...
No, we just missed, just recently, because before that, I think we were okay. Yeah, go ahead.
All right. Okay. So it's my honor and privilege to welcome Dr. AZFAR Malik. And Dr. AZFAR Malik is a visionary in the field of digital health and the founding president of the Digital Health Association of Pakistan, with extensive experience in health insurance and digital health. He currently serves as the director of employee health services of CureMed, and he's going to talk to us about the digital health in Pakistan ecosystem from inception to evaluation, challenges, and opportunity. And I think I forgot to mention that in addition to Dr. Mohammad Akhtar Hamid, Dr. Jabeen will also be joining us as the panelist. So without further ado, I'll hand it over to Dr. AZFAR Malik. Please take it away. Thank you again for joining, and thank you, Dr. AZFAR, for taking time to talk about this very important topic.
Sir, thank you very much for giving us the opportunity. My name is Dr. AZFAR Malik. I am the founding president of Digital Health Association Pakistan. And this association was incepted in 2021. That was the year that when we felt that there's a vacuum for an association to represent the growing digital health ecosystem in Pakistan. This came into my mind, and we bent upon to formulating such an association. We started in 2021, and since then we actually have three conferences. One was held in 2021, second was in 2022. So I'll just start sharing my screen, and we will be able to go through it, the brief journey of our association. Can you see my screen now, please?
Yes.
Okay. So
yes, we can.
Okay, hold on. All right. So as I told you that Digital Health Association, I am its founding president. It was actually incepted in 2021, and we represented all the digital health ecosystem, digital health companies, and the stakeholders in this ecosystem, which are partner hospitals, labs, pharmacies, and currently we have a strength of around 150 plus. So I'll just like to give a brief, go through that. This was the first conference in 2021 that we were able to organize, and Governor Punjab, Chaudhry Sarwar, was the chief guest. I'll just have a brief so that you can just have a look at it, the feel of it, of our... I hope. This was in Flighties Hotel, Lahore. For the first time, we were able to, organize this conference. Hold on. The Governor Punjab at that time was Chaudhry Mohammad Sarwar, and he was kind enough to, be the chief guest. So just have some...
एसोसिएशन के दौरान पाकिस्तान की पहली डिजिटल हेल्थ कॉन्फ्रेंस मुनक़िद करने पर मुबारकबाद पेश करूं। इस ज़मन में
let me move back to my presentation. So we had the second one in 2022. President Alvi, the president of Pakistan, was the chief guest in this conference. And in 2023, the Prime Minister Shehbaz Sharif was due to be the chief guest, but at the last moment, he could not attend due to some floods in Pakistan at that time. So this is the brief introduction. So now I will just move on to the topic now, which is the digital health ecosystem in Pakistan. Can you see my screen, everybody, please?
Yes.
Okay, sir. Great. So when we talk of digital health ecosystem in Pakistan, technically speaking, from 2019 till 2024, we had a total investment of around somewhere $50 million. And at the present, we have some around 28 digital health startups so far in Pakistan. So this is the brief capture of the ecosystem. Now, this is the basic, all right. As you can see, this slide has various verticals or the buckets. One is the medical record, one is the appointment, walk-in doctor appointment, one is telehealth, one is online pharmacy, and some in the miscellaneous group. I'll touch base the individual players also, but this is a brief picture where you can see that some of the companies are solely providing telehealth, whilst others are also providing telehealth along with online pharmacy, medical records, EMR, what you call, or walk-in doctor appointment. So this is the overall eagle's eye view of the digital health companies. Not necessarily all of them are active today, but this is an overview picture like all the players in our digital health ecosystem in Pakistan so far. Now, this is a very interesting picture which represents even my personal journey as a co-founder of a digital health company, which was Hayat.pk. When I don't know about the US market, but when in Pakistan, when we visualize something like a digital health company or a digital health startup or any idea, we just visualize it from the top and we say, oh, it's pretty simple. We will just develop an app and we will develop a telehealth app. We will develop an online pharmacy app and we will have walk-in doctor appointments. The appointment will start pouring in, we'll be rich, the revenue will be there. But actually, it's the view from the top. When we actually visualize it upfront, head on, it's not that simple. So this is a picture which actually represents the shocker that a digital health founder or a CEO visualizes when he actually steps in and his digital health idea matures from inception stage to an actual execution stage. All right, so this we have 3 slides like this. So this is the basic core of digital health ecosystem in Pakistan. I will go one by one. First of all, we'll talk of Dawai. This icon, this represents the online pharmacy module. Okay, whenever you see this icon, just you need to visualize it that the product of this company is online pharmacy. This icon, it represents the online lab. Like you can order labs from your app or your portal. So Dawai.pk, it is a digital health startup and it got a funding of around $15 million so far. And this is a very interesting set of icons. You can see somebody struggling here. They are struggling with money. They are, this icon represents the struggle that Dawai.pk is a digital health online pharmacy company, but still after getting a funding of $15 million over a period of 5 to 6 years, they are still struggling and they are not out of the danger zone or the red zone. Then another one is Sehat Kahani. This icon is of online doctor consultation. And you can see they got, and this building represents some brick and mortar model because they have opened their own pharmacies as well now. So this represents that they started as a online doctor consultation company, but now they have their own pharmacies. They got a funding of around $4.2 million so far, and they are doing pretty good. This icon represents something which is, having good positive outcome and positive growth. Then there is another company. This is the logo of doctors. They provide online doctor consultation. This icon represents OPD claims management services, which they also provide. They got a funding of around $200,000, and this icon represents that they are moving on. Neither they are in the middle stage. I mean, not booming, but also not in the dire financial constraint. So they are moving on. This is a very sad story. Meds and More, it's an online pharmacy. It also had a brick and mortar model. They opened their own pharmacies, walk-in pharmacies. They actually got a funding of $14 million. And they sadly, they closed within a period of 2 years. Marham, pretty popular digital health company of Pakistan. They have various products or verticals. They provide telehealth. This icon is for the walk-in doctor appointment booking, where you can actually book the physical clinic appointment from your computer or their app, and you can visit that consultant and in the hospital, and your appointment is pre-booked. They also provide online lab services where you book a lab order and the phlebotomist will come to your home and conduct the sample draw. They got a funding of $1 million. They are moving on. Augment Care, they provide online doctor consultation. This icon is for electronic medical record. They provide SaaS-based software as a service services for EMR. They provide online pharmacy also. And they have physical pharmacy also. They got a funding of $2.6, but they are also struggling. Find My Doctor, they deal in online doctor consultation, online pharmacy. And this icon deals with home medical services. They provide home medical services also, like IV injections, IV, any procedure like Foley removal or catheterization or something. They also provide these services. So this HealthWire, they deal in electronic medical record. They have their own pharmacies. They deal in walk-in doctor appointment. They have online lab booking. They got a funding of $4 million. Oladoc, again, as the icon says, online doctor, walk-in doctor appointment, lab. They got a funding of $1.2 million. MedIQ, online doctor, OPD claims management, online pharmacy, home medical services. They got a funding of $1.8 million. Oladoc is doing pretty well. MedIQ is going on. HealthWire is struggling. Find My Doctor is going on. Instacare, they deal in electronic medical records, SaaS-based. They also provide online lab. They got a funding of around $600,000. They are moving on. WebDoc, they provide online doctor consultation as a collaboration of insurance-based products, which they sell with telcos like EasyPesa. And they have also set up their own physical clinics also. They are doing pretty great. Hayar.pk is, I was the second co-founder of this digital health startup. I was not the first. I joined once it was closed, and I rejoined it as a second co-founder to try to revive it. But eventually we could not revive it, and it got closed. They also dealt in online pharmacy, EMR, online lab. Davago is another online pharmacy company. Xylexia deals in diagnostic imaging, AI-based. They deal in, AI-based assessment of X-rays, especially breast cancer. This is their product. They are also moving on. Mentor Health, they deal in online doctor, OPD claims management, moving on. AER was a pioneering telehealth company, online doctor consultation, opened in around 2016. They got closed. Jeete Raho, this is a diabetes management app, digital health startup in Pakistan. And they are also, struggling right now. Bima is in collaboration, is a telehealth company, and they provide telehealth services in collaboration with telcos with the insurance model, health insurance model. And they are doing okay, they are moving on, and they have around 100 plus doctors, and they provide telehealth as a combo of health insurance product. Alif Care, Mr. Abbas Yusuf Zai, he came from Silicon Valley recently, a year ago. They also have a diabetes management app startup, but it got closed. EZ Shifa, they deal in telehealth kiosk model. They have set up their kiosks, which have, which are operated by some paramedical staff. They take the vitals and remote monitoring of the vitals, and they have a screen, and a distant doctor can interact with them. They are also in Africa, probably in Kenya. They are doing well. Their kiosks are set up in Pakistan. eShafi is another company. They deal in telehealth. Humwell deal in telehealth. Sehatyab deal in telehealth. They are struggling. Diabetes Telecare is another digital health startup. In diabetes management, they are also struggling. So as you can see that most of these companies are struggling. So what are the challenges here? Can you see my slide here, please? Telehealth slide.
Yes, yes.
Okay. Now, as you can see, culture eats strategy for breakfast. Peter Drucker. In Pakistan, the challenge is that when we talk of B2C, business to consumer market for a telehealth or all, I don't know about the US market. I have heard that probably Medicare or something is linked with that, but I'm not sure of that. But in Pakistan, when we try to explore the B2C market for a telehealth, the issue is that the consumer or the ordinary citizen of Pakistan does not want to pay even rupees $0.5 or $0.3 or rupees 250 rupees for a telehealth consultation. He is willing to spend rupees 200 or $0.5 on a pan or a cigarette or a cup of tea, but they are not mentally convinced to spend something like that and get a teleconsultation, and they would prefer to go to a quack in the street rather than, if the doctor is not available nearby. This is the mindset, this is the challenge that we face today. Another challenge, now this is the role of where Digital Health Association stepped in Pakistan, because we are talking of challenges and opportunities. So the PMDC Code of Ethics 2012 section 26 actually stated that other than gynae, the use of telehealth is illegal. This is an actual clause. So whenever we used to ask the foreign investors to invest, they said that you have a body, Pakistan Medical and Dental Council. What you are doing is illegal in Pakistan. You cannot legally start providing digital health or a telehealth consultation in Pakistan. And they were right. This clause actually existed. So we met with President of Pakistan, Dr. Arif Alvi at that time. I was there in the meeting, and President Alvi had called upon that meeting. I think it is 3 years back, 2021, to actually promote telehealth in Pakistan. He was sitting in the President House. Dr. Faisal was sitting. He was health minister at that time. I told them, sir, first of all, you need to revoke this PMDC Code of Ethics. They were not aware of that, frankly speaking. So they told us to pass some resolution, and then they will revert back to it, and they will try to, revoke it if it is detrimental for the, investment landscape, and it can create legal issues for future. So Digital Health Association actually passed a resolution on 21st May 2021. This PMDC Code of Ethics section 26 should be abolished. And this resolution, the copy was sent to President of Pakistan, to Prime Minister, to Health Ministry. And actually, after our resolution, there was a press release by PMDC, and they actually, in that press release, they said that the telehealth services are legal, and PMDC supports all such telehealth services or online doctor consultation. Now, as I told you of the challenge that all the telehealth or the digital health companies in Pakistan which provide online doctor consultation, they are struggling for B2C market. And actually, when we talk of Pakistan, we have a very robust Sehat card system in Pakistan, where under universal health insurance, every Pakistani is now entitled to get health cover, which is called Sehat Card program in Pakistan. In Prime Minister Nawaz Sharif tenure, they had a certain poverty score. I think it was initially 15 PMT score, proxy mean testing score. It is sort of a poverty line. Then they raised it to 32.5, and during the last tenure of Prime Minister Imran Khan, they actually made it universal, like something like NHS. Like every citizen of Pakistan is now entitled via their CNIC card. If they are citizen of Pakistan, they can avail healthcare services under the panel network of hospitals of Sehat Card, Pan Pakistan. So we passed a resolution back in 2022 in June by Digital Health Association that, like in India, Rashtriya Svasthya Bima Yojana, this is their micro health insurance scheme, and under that scheme also they launched telehealth. Every citizen of India which has an Aadhaar card, sort of a CNIC, they can now via their telehealth portal, they can avail a telehealth consultation. And in various states, I think they have conducted around 400, around 40 million telehealth consultations so far. So what we propose to the government that this Sehat card, every beneficiary of Sehat card, every citizen of Pakistan should be entitled to have a teleconsultation portal just like India, where it should be used both for a gatekeeping purpose, like in NHS, the nurses are sitting and they are guiding the citizens of UK about which hospital to go, whether they are entitled for which county, tertiary care hospital or primary care hospital. Plus, they should get a teleconsultation facility live to the portal. We passed this resolution. And we passed this in 2022, and in 21st May 2024, actually, we kept on, canvassing, we kept on doing our networking for this resolution. The Ministry of National Health actually called me and my team. We went there and we drafted, they asked us to draft the first national telehealth policy of Pakistan. They asked us to draft it. So under Digital Health Association, we had various focus meeting groups. I think we had 5 to 6 sessions, and we mutually drafted a document for telehealth, and we presented the first national telehealth policy to the Ministry of National Health Pakistan. And fortunately, they agreed to it, and now they will incorporate telehealth district-wise in Pakistan under Sehat Card. They will start with certain districts like District Islamabad, District Pindi, District Sargodha. The citizens of that district will be entitled to avail teleconsultation if they log into the portal via their CNIC number. So this is a brief, history. When we talk of electronic medical record in Pakistan, unfortunately, the landscape is not so promising. Software as a service, when we talk, very low. When I don't know the exact, SaaS fees or the revenue model in US market, but in Pakistan, like if you talk of Pak rupees, a 30 to 40 bed hospital availing all the modules of electronic medical record, they hardly pay between 10 to 15,000 rupees in Pakistan. You can convert that in dollars. I think it's hardly $40 a month or something like that. So we have two electronic medical record companies in Pakistan. One is HealthWire, one is InstaCare. They are struggling hard. They have their ground teams. They are promoting EMR system in Pakistan. But unfortunately, the SaaS model, the revenue in Pak rupees is so, meager that it is unable to, sustain even their cloud hosting cost. So this market is also struggling in Pakistan. There is lack of awareness. The hospitals of the owners are willing to spend crores of rupees in their infrastructure, in their building, in their decoration, but they are not willing to spend more than 10,000 rupees to acquire a decent software. And neither the staff, they don't want to adapt themselves to the new technology. So what we proposed during our last digital health conference back in 2023 was that, like the restaurant industry in Pakistan under FBR, Federal Board of Revenue, now it is mandatory that each restaurant should adopt a software that is linked to FBR. So what we propose to the government that the healthcare commission, which regulates the hospitals and the healthcare providers in Pakistan, they should make it mandatory for acquiring the license of hospital that they should have a shortlisted EMR. They should implement it. The government should, actually do their due diligence and shortlist the EMRs which fall upon merit. And then every new hospital or existing hospital, if they need to apply for a provincial license for Healthcare Commission for Pakistan, which aggregates the hospital industry, and acquiring a license is mandatory now. Now they should make it mandatory under their checklist that that hospital should also have a mandatory electronic medical record. And not from anything from whatever they like, but they should provide them with a list of companies or the products which fall upon the merit and fulfill all the best practices that are used in even the US market, like identification of the patient, records, all that stuff. So this is what we are trying to do also under Digital Health Association. Online pharmacy is a market in Pakistan which is also struggling. As I gave you an example of Meds and More, it actually got a funding of 5 to 6 million, $4 plus $5 million. But the mindset is there. People don't want to order online. I will give you an example like in Pakistan, in Punjab, Clinics Pharmacy is one of the biggest chain. The owner is my friend. He's also part of Digital Health Association. He told me, AZFAR, I have more than 60 pharmacies in Punjab. And my average good pharmacy has a walk-in sale daily. People around 800 to 900 customers daily visit my one good pharmacy outlet. Just one pharmacy has a walk-in customer base of around 800 to 900 customers daily. And I have 60 pharmacies. But then he told me Meds and More is the biggest online pharmacy in Pakistan. What is their daily order flow? I told them the daily order flow is around 300 to 200 orders per day. So he said, AZFAR, listen, their online orders from Pan Pakistan is 300 orders a day. And the sale of my one pharmacy is more than 800 customers a day. So this is another challenge that we are trying to address, but we are trying to find alternative methods also. Like I have been working in the AZFAR and I was able to integrate the online pharmacy in AZFAR app. It is an e-wallet in Pakistan. More than 8 to 9 active users of AZFAR e-wallet in Pakistan at the grassroots level. And we integrated that online pharmacy in AZFAR. So anywhere in Pakistan, people can order authentic medicine and it will be delivered to their doorstep via courier. So this is one other model, but still this industry is also struggling in Pakistan. Walk-in doctor appointment is also a very popular vertical in digital health ecosystem in Pakistan, where you can book the appointment of a physical doctor from your portal or app. But here the challenge is that the person, as you see, who is sitting in front of consultant's office, you call him a munshi or a watchman or something, he is not willing to honor that online consultation time slot. He will mostly, in most of the cases, he will say, okay, even if you have an online appointment of 6:30, you booked it online, but I will let you in at 7:30 because I have my own checklist. I have my own preference. So this is another challenge where I say the culture does not fit. The culture is eating the strategy here. Next, we have one very successful online model of digital health, and that is the lab. And I would appreciate Dr. Umar Chughtai, who is also an association member of Digital Health Association. Chughtai lab has more than 500 to 400 outlets span Pakistan. And they have really tapped the online lab order booking in Pakistan, both via B2B collaboration with digital health companies and via their own portal, and mostly via B2B with other digital health companies. Like Maram and Oladoc, they will integrate the online lab order at within their app, and the phlebotomist of Chughtai lab would reach their house within 1 hour or 2 hours, maximum 1 hour. They will have a sample draw, and within 6 to 7 hours, the report will be sent via link, via WhatsApp or all that stuff. So this is one model where actually in Pakistan, the online lab ecosystem is actually booming. People hardly go to labs now. Everywhere people are trying to book order online via the WhatsApp group or via WhatsApp number of Chuktai Lab or via the digital health company. So this is something which is actually a good, you know, scope in Pakistan where this ecosystem is booming. So this is the some basic overview. Now it's up to you. If you have any questions, you need to ask anything, you need some clarity, I am there to answer everything.
Thank you very much, Dr. Asfar Malik. It's a very eye-opener sort of thing. And we are so lucky that we are listening all about, because many of these people like Sehat Kahani, Medicine and More, Med IQ, they gave the presentation and a webinar on this channel. So it's very interesting. So my first question is like one vertical like the Chuktai lab, they are very successful. What about the others? Like we have the largest network of Aga Khan, Shaukat Khanam, Islamabad Diagnostic Center. So are they following the same pathway? That is the one question. The
No
next
Chuktai
question,
lab. Okay, please proceed, sir.
yeah. And my next question is that out of many, one vertical is so successful and many others, they are struggling. So the appetite, the culture, that remain the same in Pakistan. So why one is successful while others they are struggling? Yes, please.
It's a very pertinent question. First of all, the Chuktai lab is following a profit sharing or a revenue sharing model. Whenever a digital health startup integrates with them, they get a percentage of revenue. I will not share the exact numbers, but anything between 10 to 30% with them. It's up to the digital health company to forward that percentage discount to the patient or to keep some of it as their revenue. Secondly, the reason is that their outlets have spread like a mushroom growth pan Pakistan. So they have a very diligent order follow-up system. Whenever an online lab order reaches their portal or interface, either directly or via interface of some digital health company, they are quick to respond. The moment you order, within 5 minutes, you will get a confirmation call. They will ask you for your PIN and they will send you a code. That code the patient will receive. And within, they will even ask you the time at which the phlebotomist would arrive at your doorstep. And usually, even if you say, let them come within 15 minutes or 20 minutes, actually they arrive within 30 minutes, 20 minutes. Reason being because their radius in Lahore, they have more than 30, 40 branches. So they can cover the radius. And within no span of time, they jump in to at your doorstep. They are professional. They conduct the sample draw. They take the code. The patient usually gets a discount of 10 to 15%, whatever digital health company they are cooperating it. That code is documented in their backend ledger. And if any percentage revenue share is, let's suppose that order is via Marham, and that specific code is generated and it is sent to patient as well as to the logbook of Marham. So whenever, let's say, order is of a CBC, a patient books that order, and at the time of payment, they enter that code to the phlebotomist. That revenue share is documented for that digital health startup. At the end of the month, they do receive that payment. I actually received myself for Hayat, and they are very diligent in paying it. They don't cheat. They actually pay the exact share which is documented. The second thing is that the quality of services, the phlebotomist is at their doorstep within 20, 30 minutes or whatever time the patient says. So actually the proof of concept is there. When you order, you actually see a well-dressed phlebotomist at the front of your door. You say, oh, it's not fake. They are actually doing it. And when they conduct the sample, you pay within the TAT turnaround time, if it is 6 hours, depending upon the lab test, normally it is 5 to 6 hours for non-specialized test. You actually get a report at your designated WhatsApp number or SMS number in the form of a link or a PDF. And you are actually able to track that. So the proof of concept is there. The psyche, I don't know about the US market, but in Pakistan, again, my friend who is owner of clinics, he was part of this discussion with me that AZFAR in Food Panda, why you always order from McDonald's and from KFC and from Pizza Hut? Why don't you order from Baji Nasreen's kitchen, which is 10 times cheaper? Right? So he said that actually you see the outlets of Food Panda everywhere. And the proof of concept is there that this is a valid service provider of food industry. And even when you order online, the proof of concept is there. Similarly, when you talk of, he said that when you talk of online lab, when we say Chuktai lab was actually able to first set up its mushroom growth in Pakistan. The proof of concept is there. We see. And so where we feel comfortable and confident whilst ordering something from that online. And the services are good. That order is actually has a turnaround time of 30 minutes, 20 minutes to actually get that order. In the online pharmacy, unfortunately, what we observe that the pharmacies or the digital health companies which are offering these services, they are not so robust. Whenever you actually order something, in the first place, the inventory is not updated. You order something from the app and then you come to know that the price has changed. It's not 400 rupees now. As per Drug Regulatory Authority, the price has jumped to 550. So first of all the e-commerce calculation gets wrong. You don't get it via Food Panda. If you order something at 800 rupees, it is 800 rupees. So first of all is the pricing challenge. In Pakistan, the prices are fluctuating in pharmacy industry every 2 months. Secondly, the online delivery order, Airlift was able to do it within time span of 30 minutes or 40 minutes, but unfortunately, the home delivery services are not so prompt. Thirdly, when you talk of online doctor consultation, again, I say the digital health companies are doing pretty good. They have hired pertinent professional doctors, qualified doctors, but somewhere the mindset is not there to get a consultation online. Maybe the people of Pakistan don't have the paying methods also. Is the payment method is also a challenge. How to pay 250 rupees online? Average user in Pakistan don't have a smartphone. They don't have enough space. Even if they have smartphone, they don't have a credit or debit card. Even if they are using an e-wallet, Jazz Cash or Easy Paisa, they don't have the average amount in their Easy Paisa is not more than 100 rupees, 200 rupees in their wallet. So paying method is also don't compare it with US market where every citizen has a debit credit card or online paying method. So, and in online doctor consultation, cash on delivery, it cannot happen. Okay. So this is another challenge. So, but still, it's an evolving field. And we truly believe that once this online doctor consultation, telehealth gets incorporated in Sehat card, we will not only the incidence rate of admission shall fall, but via gatekeeping, via OPD consultation, the government shall save billions of rupees. Because the research says that if you add telehealth to an insurance product, the hospitalization incidence rate usually decreases anywhere between 2% to 8%, depending upon the various circumstances. So even if the average hospital bill of Sehat card is rupees 60,000 or 50,000, right now the expenditure on Sehat card is 200 billion rupees per year. So if we are able to reduce the hospital incidence rate by adding telehealth even by 5%, we will save billions of rupees. And the cost of incorporating telehealth is a fraction of that. So these are all things that we are struggling. We are trying to convince the government. This is what the Digital Health Association is trying to do. We also need your support in this regard. Uh, Anywhere we need more frequent meetings and focus groups, we can have more discussions like that. But we need your support. We, with our limited resources, we are trying to promote health digitization in Pakistan, but we have our own limitations, sir. And that's why looking forward to you to help.
Dr. Asfar, yeah, before moving to Dr. Akhtar Hamid, uh, from the business perspective, as a business model, you know that the margin in, there is a defined margin for the medicine that the retailer they can keep as per the drug law, which is 15%. So the
15
margin
to
is
15 to 18%. It fluctuates depending upon the item.
yeah,
Yes.
yeah. And in case of lab work, the margins are extremely deep. I mean, like a glucose you get for 20 rupees or 15 rupees, the reagent, and putting the
40
operational cost.
40% to 50%. The region cost is hardly 15%. I know, sir. I
Yes,
know.
yes. So altogether, putting all together, their margins are like ranging between 80 to 90%. So portioning that to the end user, portioning that to the associated partner, that is easy from the business, the
Yes.
financial modeling of business. While from the baseline, the medicine and more, they presented their case here on this forum as well. So from the baseline, I think that gentleman has a quite a deep understanding and everything about launching few other things in Pakistan. But in this case, if you go to the modeling, I think from the basic, the challenge is to build a model on something where the margin are, so thin. So that could be one of the reason in addition to the what you mentioned about the culture and all those other issues. So even in the vertical, as a business unit, I think every case merit its own discussion. So
Yes.
how to build the model? Because in services like as a physician, these are the services. So in services, you can share the margin. You have the cushion because in actual term, it's not a product, but in product, you do not have much choices available with you. So that could be one of the reason, but I think to understand the ecosystem, it's very important to study each and every vertical by its own merit and demerit. So these are the things. There could be, there are few outlets which are very famous because the people they believe that they sell quality products. So if you convince and establish the quality, like in Pakistan, spurious medicine is the big challenge. You know that globally it has been pointed out. It's very, very, and particularly in the peripheral areas, in small town and in KPK, these are the issues. So maybe, even in Karachi, you go to certain chemist and in Lahore, you go to certain chemist because you believe that they sell quality product. So if the people, they have a faith in the quality, so based on the quality, the same customer is paying to a restaurant, a very, very hefty bill, but culturally, they are not willing to contribute toward like electronic medical record, and you have to impose through the regulator or, the few other people. So these are very interesting debate that can be continued. So
Yes.
let me invite Dr. Akhtar Hamid to unmute himself and, please comment. Yes, Dr. Akhtar.
Thank you, Dr. Jose. I mean, what I'm hearing that reliability and performance is the two key element here to run this digital marketing or digital health, um, apart from other factors which has been discussed already. Um, Unfortunately, we haven't been able to, ourselves um, put ourselves forward for the reliability and dependability because, as Dr. Zaid is saying, the, the the medicine quality is not good. Now, I'm going to bring another point here that when you're talking about these commercial products, what about these charity hospitals like Shaukat Khanam, Indus Hospital, and Child Life, who has their digital health? Like I can tell you, like Child Life Foundation, who only deals with the pediatric emergency, they have hundreds of points where they basically treat the patient on telehealth, and also on from the video link. Like one of the senior doctors is sitting in one center and he's running 6 centers with that. Number one. Number two, these hospitals also, as far as I know, has successfully introduced the EMR system, and they are also running this very smoothly. So why in Pakistan other bigger hospitals not able to do it? Is it just because there is no law there, or is it there's no intention for the hospital to spend money on this sector?
Okay, when you talk of Shaukat Khanam, actually I'm privy to their EMR. They actually launched their own EMR. They inbuilt it, you know, and I think they called it Shaukat Soft. And to build an EMR from the scratch, from your own server, you know, it needs a lot of resources. Not every hospital can afford it. Building an EMR is not a piece of cake. It requires millions of rupees of resources and over time training and improvement. And now, after implementing Shaukat Soft in Shaukat Khana for so many years, I know that now they have sent it as a SaaS model or something like that to Fatima Memorial Hospital also, because the board of directors, the chairman there, somebody from their board is also a member of board of Fatima Memorial. So they are actually selling it for a reasonable monthly contribution or whatever you call it. But every hospital in Pakistan cannot afford to have their own EMR cell. They have two options. I mean, the most economical is that we have two EMR companies in Pakistan, SaaS-based HealthWire and InstaCare. And to be honest, they are in very reasonable rates, like hardly 20,000 rupees or 15, depending on the modules that they take. If they want lab module, pharmacy, IPD, OPD, hardly it's $25,000 to $30,000 a month. So they $100, hardly $100 a month. So they provide these SaaS based, and at the back end, even they are going on loss. The cloud fee which the HealthWire is paying is 30 lakh rupees a month for data storage. But what the revenue that they're getting is not that much, because Pakistani market is paying in rupees. Like I work in CureMD. It provides EMR for US market, and they easily generate a revenue of $70 to $80 million a year. The owner, Bilal Ashmat, is also a friend of mine. He's also a mentor and he sponsors Digital Health Association. He told me, Asfar, we started this product back in 1995 for Pakistani market, but we came to know that they don't have the paying capacity, and we were about to, you know, bankrupt. But then luckily we find a market, a hospital in US who are paying in dollars, and we were able to, you know, get out of the red zone, and we started tapping that market. The issue is in Pakistan, although the hospitals are earning enough, but somewhere the mindset is not there to spend something so much on to pay on the EMR section. But once you regulate it, you make it mandatory, then I think the competition will spring up, and then even the EMR companies in Pakistan would be able to raise their slabs. But right now, even for paying $100 a month, you know, I have been in marketing and sales also. It's not easy. So as far as I know, in US, I don't know, I'm not for implementing ICT. The government had to implement some regulations and all that stuff, and they really had to, you know, grasp the hand of doctors and twist it to implement it. That's what I know. Even the doctors were not willing to type. They had to hire somebody else to do the history taking and all that stuff. I don't know, but what I get the feel, even to implement the digitization or EMR in USA, the ICD coding, it took some legislation and some, you know, arm twisting by the government. So in Pakistan also, I think for EMR implementation to make it grow and prosper and for the health outcomes, I'm not saying it for the benefit of HealthWire or InstaCare, or if the electronic medical record is digitized in Pakistan, it will actually increase the health outcome of people of Pakistan. This is a fact. Right now, the health data is not homogenized in Pakistan. We are unable to, from Sheikh Zayed Hospital, if somebody visits and he goes to Services Hospital, which is another government hospital in Pakistan, the lab reports are not, interoperable. They do their own labs. So this is something I think, again, as Uzair Sab said, we need to have some multiple brainstorming sessions. This is the first one. Let's have multiple sessions. Let's brainstorm it. Let's try to find out a way. We will not be able to devise a strategy or to look forward to find something via just one webinar. So let's keep on moving and
No,
keep
I
on.
thank you. I just want to know, because you are in the influential community. I mean, what is stopping them to implement it? Because if you look at, I'm practicing in Canada, almost every hospital has some sort of EMR, different EMR models here. Even a private clinic, more than 95% running with the EMR. You have to just pay some services, and that's you go. And you're right. It's not the for the business purpose. It's just more health health purpose. Because if a person's information is available on the system, so then it will be easy for people to manage them, and the history is there, and their all data is there for management point of view. Why the private or the charity hospitals are able to um, manage it, but not the government sector, although our government and our bureaucrats pay several visits to outside the country, and then they see the system, they admire the system. So what is stopping them? Because if the data is not being homogenized, or if our health record is not being properly managed, then we are living in a stone age, which we are, unfortunately.
Stopping the government to implement this legislation to make it mandatory. This is your question?
I'm saying it. Why not our government or our elite which travels, and bureaucrat which travels a lot and several times a year outside the country, coming to US, Canada, Europe, UK. When you guys were talking about legislation, digital health, why they were not, looking into that factor too?
Probably the Digital Health Association is a newly incepted body with a lifespan of 3 years. We are taking baby steps. We are not as strong as PASHA, Pakistan Software Association. I have to send various letters to ministry, to PM office. President Alvi was kind enough, actually he was an intellectual, to be the chief guest, right? So we were able to put forward our demands in front of him. Prime Minister Shehbaz Sharif also gave us time, but we were unable to catch up with him now. So probably we are not that strong, I'll be very honest. We are not that strong a pressure group. We need your help. If you can help us fix a meeting, I have sent numerous letters to PM office for a meeting call, right? Since the start of the year. But since I'm struggling to have a meeting with them, we request you to help us to.
Dr. Aswar, so we are very lucky that in our participant we have Professor Zulfikar Bhutta, who is one of the policy maker and at the forefront during many regime. So his comment is the data that need homogenizing first are the DHIS that are there and homogenized. Start with that exist and can be shown to make a difference to planning. So he is quite an innovator and a policy maker of healthcare delivery in Pakistan, over very active over the last many decades. So there here you will find the people who really are interested and can take this flag, so your message is getting across. So would you like to respond to this comment I have just read for you?
Let me read it actually. Please,
The-
can you narrate it for me? I could not get the essence
yeah,
of this.
okay. So just I'm going to send it. Messaging is directly to you so that you can see it by
Yes,
yourself. Give me a second. Uh, so I'm sending you. So this is the message
let me.
from Professor Bhutta. So now you can read it.
You have sent it via WhatsApp or via inbox?
No. It's here in the chat. So I have
Hold on.
sent you in the chat. Yeah.
The data that needs
Yeah.
homogenizing first are the DHA data there. And what does this means? I'll be very honest, I don't understand this comment.
Okay.
You need
No,
to
no
simplify
problem.
it.
No problem. So later on, I will just get his question and pass it on to you. So we have with us Dr. Professor Sarvat Hussain from US. So Dr. Sarvat, can you unmute really and have your comments, please?
Ji, Assalamu alaikum. I think this is a very eye opener, and we in the US and in this group uh, don't always take into consideration that culture eats the lunch for strategy as well as business plan, etc. My specific
Because
question
sir,
is
in
that
US, the culture is actually dating the innovation. You are a developed nation. Here, the culture actually dates and marries the strategy, and they have multiple
right,
kids.
very true. Well, I'm actually not a developed nation because I'm from Pakistan. So they are developed nation here. Just a joke. Now, my question is this: that what is the way to monetize and make the delivery of the products profitable so that it can attract more investment and greater services and more high quality services?
So first of all, it depends upon the product. When you talk of digital health ecosystem, we have various. Today was actually my lecture.
No, no,
We have,
not I'm sorry, not the service. I mean the drugs, medicines,
so you are talking of online pharmacy or brick and
yeah,
mortar model.
or online form.
Sir, unfortunately, we don't have an encouraging example of online pharmacy success in Pakistan. The Meds and More is a very, vibrant example of that. Reason, as Uzair Saab said, that hardly the margins are between 15% to 16%. Okay. And
Right.
the
No, but my
operating,
question, sorry to interrupt you, but my question is, how can that be made profitable so that it will take off and benefit the people? That's my question, in your opinion.
I think the only way is the economies of scale. Okay, just as I told you the example, like one of my mentor told me that as for how many downloads are in your app, I said, sir, proudly, sir, 50,000 downloads. He said, as for by the time you will have 1 lakh downloads, your funding will be expired and your company will be finished. So don't bet on your individual downloads. Try to tap the economies of scale. I gave you the example of integration of online pharmacy in AZFAR, which already has 8 to 9 million active users and a base of 2 crore actual downloads. And the active users, as you know, are between the range of 7 to 8% or something like that. So I think the only way forward is via these popular apps like Food Panda. We have successful models there that the pharmacies that they have integrated there, they are actually able to, get the traction. Easy Pesa and Jazz Cash, I think they are the avenues that we need to tap more seriously. And we need that the authentic medicine somewhere in district Haran of Balochistan, where there is no authentic pharmacy. If somebody orders via Easy Pesa, even like in Daraz, if you today order something and even if it arrives after 1 week, people know that it is an authentic order. They will not be cheated. So if we are able to establish our credibility via these popular e-wallets and popular apps which have the base, and the turnaround time of order delivery is improved, the back-end contracts of courier fees are negotiated by economies of scale, we'll be able to break it down.
But very quick question: if the profit margin is only 15%, and the the delivery cost itself can be, will eat out of that profit margin,
Yes,
will it
yes.
ever become profitable?
Yes, it does become profitable. I think because I was dealing my online pharmacy, as soon as the order, let's suppose it reaches 3,000 rupees, sir. Okay. So let's suppose it is 15%. You are earning actually 450 to 500 rupees at the rate of 15% or 16%, right? at an order of 3,000, you get a profit of 500 rupees. Once the order slab improves, so even if this 500, you are able to give rupees 150 to courier fees, right? So you are able to save 350 rupees, and let's suppose your admin cost is 200 rupees or something, 15% of that. But the real reason is the economies of scale. Like even if you talk of India, netmeds.com was a very vibrant online pharmacy in India, but still they couldn't make it also. Again, it's a learning curve, sir. A digital health ecosystem, digital health startups in Pakistan, they are taking baby steps. In US, even if you talk of Teladoc, its share value fell more than 90%. You know, their success and failures are everywhere in UAE. What I heard in US market, every year there's a record number of companies registration and record of companies that go bankrupt, right?
Yes.
So I mean, this happens. We all learn from our mistakes. We all learn from our ecosystem. Like Medson Moore spent $2 million on advertising for 2 months in Pakistan on online pharmacy, and hardly their daily orders spiked from 300 to 600 by spending 40 crore. Dollar was rupees 200 at that time. What they did get out of it. Before advertisement, they were having a sale of 350 orders or $400 orders per day pan Pakistan, and after that massive campaign, hardly 200 or 300 orders increase. So we learn from our mistakes. We learn from when we implement something, we learn from it. We are in that process. So let us learn. Let us keep on learning. This is what I think.
Okay.
Thank you. I think it's
So,
after 1 o'clock. Then we'll let
yeah,
Uzair Bhai.
yeah, just a word. So, can you bring Professor Zulfikar Bhutta, really the coordinator?
I would raise one request here is, sir, via APPNA, for the benefit of Pakistan. We have spent multiple request letters. I have talked to military secretary, deputy military secretary of PM for a meeting. We would request you if you can help us in securing a meeting time. I was able to meet Dr. Mukhtar, the federal minister. He is also my class fellow. He did accommodate us, but we are really striving to catch a meeting with Prime Minister, because I know that Prime Minister Shehbaz Sharif, if you are able to present facts to him, and if you are able to present that by implementing EMR, by implementing telehealth, this will be the saving. This is the cost in crores, and this is the savings in billions. So I really
Well, you
need
can
to.
send him. You can send him for form 47. He'll give you the
So
meeting.
regardless of the political affiliation, I mean, whoever is running the state of Pakistan, we need their collaboration, be it anybody. We are apolitical.
Sure, sure, sure.
Whoever is
So,
at the helm of affairs, let us be, because the decision making will be at that forum. We met President
true.
Alvi. He was kind enough to, but he had no powers technically. But he was
So,
very.
Dr. Asfar, there is someone from the participant, and they are looking to help on this thing. First of all, please share your email in the
Okay,
chat
I did.
box
Right,
so
sir.
that they can contact you, and somebody has responded that he can help you making that meeting. So
Sure.
that's one thing, and we will keep in touch. So this is already like 5 minutes over. We have so many questions. We have learned so much about this thing and at a very macro level about the total ecosystem. Mashallah, you are full of knowledge and you have full command and you have a passion to take it to the next level. It's fantastic and it's a good addition. We also
I would
formulate,
just like to share one more thing, I think, which I missed.
yes.
Let me, via Health Services Academy, Professor Shehzad. Hold on. Recently, for digital health, we started this, I think, diploma in digital health. Let me open it. This. So actually, you can see the mentors here. They're all, Dr. Umar Chukta is there. They are willing to give their mentor lesson. Shaukat Ali Khan from Aga Khan, Dr. Sara. All these are big players in digital health. Bilal Ashmat from CureMD. So we have actually, for the first time in Pakistan, we have started a digital health diploma for this digital health awareness and to help the, or anyone who wants to get acclimatized with the health digitization in Pakistan, in collaboration with Health Services Academy. This is our initiative that we recently started.
Wonderful. I think capacity building is one of the key issue. So I think that's very, very impressive. So Dr. Asfar Malik, thank you very much for your very precious time and for taking all the pain. And we will formally, I think there is a question, raised hand by Dr. Bilal Afzal. So can you open his mic? Really, he can ask the question. So Dr. Bilal Afzal, you can ask the question directly. Unmute yourself. You are muted, Dr. Bilal. Dr. Bilal Afzal, you are muted. So I think they have some technology issue because he is muted and he has raised the hand. Anyway, so Dr. Asfar
He
Malik,
can text that question in the chat.
yes, and we can send it to you. So my request is that we look forward to invite you as a speaker about the healthcare insurance in Pakistan in a separate, sometime dedicated to that thing because you have so much knowledge and you are also the author and you created many scenarios. We will be part of your network and we will work together really to take it to the next level, whatever we can do. He's sitting over here and I hope that that will move a long way. We are also thankful to Professor Sarwat Hussain, Professor Akhtar Hamid, and our technical team for all the support and everything, and most important, our valuable participant who spared their time and they stayed with us till the end. We are extremely thankful to all of you for participating. So with this, we are going to close today's session and see you after a gap of 15 days. We look forward. So all the best and enjoy your weekend. Thank you
Thank
very
you,
much
sir.
and
The
bye-bye.
pleasure was all mine. The honor was all mine. Thank you.